This video will cover breast pumping and storing milk. Our takeaways will include an overview of the basics of pumping, understanding cleaning of pump parts, and storage and preparation of breast milk. Many mothers start pumping sometime after birth. Some women start pumping within the first couple days of birth, especially if they are separated from their baby, have a history of low milk supply, or are needing to supplement their baby with their pumped colostrum or milk. Breast pumping may be encouraged early by your care team for a variety of reasons. Many women also start pumping within the first few weeks after breastfeeds if they feel like they haven't emptied, and then they have that pumped milk available to supplement future feeds or for help with nighttime feeds. If you have been exclusively breastfeeding and are planning to return to work or school or needing to be away for your baby for any reason, it is recommended that you start pumping a few weeks in advance. This will give you a chance to get into a rhythm and your baby a chance to get used to bottle feeding. When you are pumping, it is best to pump at the same time or as often as your baby has been breastfeeding. Pumping for 15 to 20 minutes tends to be sufficient. Keeping your pump parts clean is important. After each use, it is important to take apart the separate parts that come into contact with the breast milk, rinse, and clean based on the manufacturer's instructions. If you're using a wash basin or bottle brush, make sure you rinse them and let them air dry after. Consider washing them every few days, either in the dishwasher or by hand. After they are dry, make sure you have clean hands when reassembling your pump. Store in a clean, protected area, and inspect your tubing occasionally. Sometimes a buildup of condensation or mold happens, and you may need to replace them. To dry out the tubes, disconnect the tubing from the flanges and collecting chamber, and run the pump for a few minutes. Use milk storage bags or clean food-grade containers with a tight lid that are glass or non-BPA containing plastic. Freshly pumped milk can be stored at room temperature for up to 4 hours, in the fridge for 4 days, and in the freezer for 12 months. Ideally, 6 months is recommended. Label your milk with the date it was pumped and avoid storing milk in the doors of the fridge or the freezer, as these areas tend to have more temperature changes. Leave a little space at the top of the container if you're freezing milk, as frozen milk tends to expand a little. Thaw the oldest milk first. You can thaw it in the fridge overnight, set in a container of lukewarm water, or use a milk thawing appliance. Do not thaw the milk in the microwave, as it can create hot spots that burn your baby's mouth and can destroy some of the nutrients. Use milk within 24 hours of thawing in the refrigerator and do not refreeze. Once the milk is brought to room temperature or warmed from the refrigerator, use it within 2 hours. Thank you for watching this overview of the basics of pumping, cleaning pump parts, and storage and preparation of breast milk.